Hi to everyone, welcome back to Vijitha Rajkumar online video classes. Today I would like to give some of the important questions in the subject of the zoology as well as the health promotion. So zoology for the regular BPC and intervocational bridge course second year students. Okay, and next health promotion, this is the subject of the MPHW first year students. In this also like a sub-partitions will be there. Under the health promotion, like a nutrition will be there, and next one is the anatomy and physiology, guidance and counseling, mental health. So many subunits will be there. Under that, one of the unit is the anatomy and physiology. Okay, so once again, I want to review the introduction about this content. Okay, zoology for the regular BPC as well as the intervocational bridge course students. Next, coming to the one more subject is the health promotion for the MPHW first year students. Under that, anatomy and physiology. Okay, so this is the only for the English medium students. Okay, so we are moving on the session. So already I uploaded two videos. So first video is the respiratory system, second one is the structure of the heart of the man, and next coming to the third, this video is the clotting of blood. Okay, clotting of blood. So here so little bit whenever necessary I will give the some of the brief description about the content. So meanwhile we have to note down the notes. So many members are requested to please provide the English medium content for, so that the reason only. Okay, I used to refer this content for you people. Okay, so we are moving on the session one by one, like a clotting of the blood. Okay, so when we will blood will clot, so if you will get the any injuries, automatically the blood will flow and simultaneously within the fraction of second it will be clot. Okay, so this is the mechanism we will know about this by observing this content. Okay, when blood vessel is injured, a number of physiological mechanisms are activated that promote hemostasis. Okay, when we will get the injured, what will happen? Automatically the blood will flow, so within the fraction of second automatically the blood will be clot. Okay, so when a blood vessel actually the blood will be supplied with the help of the blood vessels. It's clear that you have to got it in your mind. Okay, so number of physiological mechanisms are activated. Why they will activated? To promote the hemostasis. Hemostasis is nothing but the heme is nothing but the heme is blood, stasis means standing, equilibrium. Okay, this is the breakage of blood vessels exposes collagen proteins to the blood. So when the blood vessels break, what will happen? Automatically it will expose the collagen proteins to the blood. So for this reason only automatically the blood will be clot. Okay, the incision 3 is separate but overlapping hemostatic mechanisms. The three factors will be there. So first one, the vasoconstrictions will be there, and next one is the formation of the platelet plug, and next one is the production of the web of fibrin proteins. There are three mechanisms will be there when we will get the injured of the blood vessels. Okay, next. So what is the meaning of the vasoconstriction? Constriction is nothing but the like this will be. This is the constriction, this is the dilation. It's clear. So when we will get the injured, whatever the blood vessels will be, automatically it will constrict like this. Vaso is nothing but the vessels. Okay, when the blood vessels is damaged, the smooth muscles in the wall contract, which makes the lumen of the vessels narrow, sometimes so strongly that blood flow is completely stopped. So what will happen if so depends upon the injury of the condition. Sometimes the blood vessels will be get injuries may be narrow, sometimes it will get the strongly that affected, automatically completely the blood flow is completely stopped. This is called as a vasoconstriction. Next coming to the platelet plug. Okay, so plug formations will be there. Okay, when the endothelium is ruptured, platelets adherent to the collagen release some secretions. So due to the secretions, what will happen? It will make them too sticky, so that the adhered those already stuck on the collagen and forming. So some of the secretions will be released. Due to these secretions, it will make them sticky. So automatically it will form some of the platelet plug. Next one is the production of the web of fibrin protein. Okay, the third mechanisms for the hemostasis is the formation of the clot. The activated substances from the injured vascular wall, platelets and blood proteins adhering to the injured vascular wall initiate the clotting process. Adherence is nothing but the attachment. Okay, so when we have the problem, it will automatically attach the blood vessels. Okay, vascular wall will be there. Now, for example, we will get the injured here. What will happen? Automatically the blood will supply through the blood vessels. It will connect into the blood vessels. Okay. So what will happen? The initiating the process will be there, like the vasoconstrictions and formation of the platelet plug, and next one is the production of this web of fibrin proteins. Okay. The clot is a web of protein which blood cells are trapped in it. Okay. So, the three mechanisms will be there. Next, coming the mechanism of the blood clot. So, how it will going on in the way. So, there are the three steps will be there, like a step 1, not step 1. So, meanwhile, we will see one by one. Okay. Clotting take place in 3 essential steps. Actually, when we will get the injury, what will happen? First one is the bleeding. Second one is the clotting. Okay. So, when we will get the injured for any reason. Okay. So, what will happen? First the step is the bleeding will be occur. So, that is also a fraction of seconds will be there, and in the fraction of second after the stopping of the bleeding, automatically what will happen? Bleeding going on like this, it will be take some seconds, automatically it will be clotting. Okay. So, when we will get the injured, bleeding will be there, simultaneous clotting also will be there, two process will be there. So, when we will get the injured of the blood vessels. Okay. So, here the first one is involves the formation of the complex of activated substances collectively called prothrombin activator. Okay. So, here the chemical reactions that occur in the body by the involvement of clotting factors into pathways. Okay. So, here step 1. So, this is a formation of the blood clotting. There are two steps will be there. First one is the intrinsic pathway and extrinsic pathway. Intrinsic is nothing but the involvement within the or inner side. Okay. Intrinsic pathway is nothing but the inner side. Extrinsic pathway is nothing but the outside. Okay. So, let me see the intrinsic pathway. So, here the occurs when the blood is exposed to the collagen of injured epithelium of blood vessels. This everything is going on inside the blood vessels. It's inside the body of the blood vessels. Clear? So, when we will get when the blood is exposed to the collagen of injured epithelium of the blood vessels, this activates factor 12 and in turn it activates another clotting factor. So, which activates yet another reaction which results in the formation of the prothrombin activator. Okay, intrinsic pathway it will only within the blood vessels, within the body of the blood vessels. Okay. So, here the activates when we will expose the collagen of injured epithelium of the blood vessels, it activates when we will get the injury of the endothelium of the blood vessels, it activates a factor 12th and it turn into activates another clotting factors. Okay. Here the which results when we activating another clotting factor which results in the formation of the prothrombin activator. So, automatically it will activate the prothrombin activator. Okay. So, next in the extrinsic pathway, here it occurs when the vascular wall is severely damaged and extravascular tissue comes into contact with the blood. This activates the release of the tissue thromboplastin and form the damaged tissue. It activates the factor 7. As a result of these cascade reactions, the final product formed is a prothrombin activator. So, here the extrinsic is nothing but outside the body. So, here when we exposing the outside of the body, damage the extravascular tissue comes in contact with the blood. So, it will extravascular tissue comes in contact with the blood. So, it will release some of the tissue thromboplastin. So, here automatically when we release the tissue of thromboplastin, it will activates the factor 7. So, as a result of this one, the final product form, so it is known as a prothrombin activator. So, intrinsic here it will activate the factor 12th. So, that is the reason it will form the prothrombin activator. Extrinsic pathway it will activates the factor 7th. So, due to that reason only it will form the prothrombin activator. So, here the two will be there. So, it is inside the body of the blood vessels. Extrinsic is nothing but the outside the blood vessels. Okay, it is clear. So, next coming to the step 2. So, here the step 2 also the prothrombin activated in the presence of a sufficient calcium plus. So, it causes a conversion of the inactive prothrombin to activated prothrombin. Okay. See here in step 2, if you will see the step 2, so here the only will be there. So, here is the presence of the sufficient amounts of the calcium plus. So, here due to this one, so it will causes the inactive prothrombin to active thrombin. It is clear? Inactive prothrombin to it will activate to the thrombin. Okay. So, this is a step 2. So, step 1 there are two will be the like a extrinsic, intrinsic. There are the intrinsic factor 12th, extrinsic factor 7. Step 2 it will activate the inactivate prothrombin to active thrombin. So, 2 points will be the no need of write everything, just important points you can focus, you can write it those things only. Okay. And next coming to the if you see the step 3, the thrombin converts the soluble protein fibrinogen into soluble fibrin monomers. So, which are held together by weak hydrogen bonds, the fibrin stabilizing factor 13 released from platelets replaces hydrogen bonds with covalent bonds and cross links to fiber protein. So, here the mesh work will be there. Insoluble mesh work of fibrin fibers spreading in all the directions adherent to the damaged surfaces and trap the blood cells and platelets. So, here in step 3, so here it will convert the soluble protein fibrinogen into soluble fibrin. It is clear. So, in step 3, it will convert the soluble protein fibrinogen into soluble fibrin. So, this is the reason only it will release the factor 13th factor. So, it is released from the plates. Okay, that is the reason automatically the blood will be clot. Okay. So, platelets are also called as the clotting factors. So, mainly for the when we will get the injury, we will have the bleeding, automatically we will have the clotting. So, here for the clotting, it is mainly responsible factor is the platelets. It is clear. Okay. So, here the mesh work will be formed. Okay. And next coming to the, if you will see the clotting factors, okay, the factor 1, 2, 3, 4, 5, 6, 7, 8, 9 will be there. Okay. So, here the first factor 1 fibrinogen, factor 2, okay, prothrombin, factor 3 thromboplastin, factor 4 calcium ions C++, next fifth, okay, proacceleratin labile factor, 7th pro-convertin stable factor, 8th one, okay, anti-hemophilic factor A, and next 9th one plasmathromboplastin component PTC or Christmas factor. Okay, next Stewart Prover factor, next 11th one is a plasmathromboplastin and then PTA, next Huysmans factor, next fibrin stabilizing factor. So, these are all the some of the factor 6th is no longer period, it may not be there in longer. So, remaining all the things, these are responsible factors for the clotting of the blood. So, in the human body, it is clear. So, next coming to the anticoagulants. Next, so here the some of the box will be there, and if you read the box, so one will go through the box. Do you know about the platelets? Platelets are necessary for clotting retraction. Failure of clot retraction is an indicator that the number of platelets in the blood might be low. In the case of diseases such as dengue and platelets count falls low and patient may require transfusion of blood platelets. So, when we will get the injured, so automatically what will happen, I told no, bleeding will be there simultaneously, it will take some time to clotting the blood. If any patient will be taking the more time to clot the blood, so in some of the cases like dengue cases, in dengue case automatically the plate will be count will be fall slow. So, that is the reason the patient may require the blood to clot the blood. So, from the occurrence of the problem. Okay, na? So, it is clear. So, next one is the anticoagulants. Okay, here the heparin is the anticoagulant synthesized by mast cells and basophils. It activates antithrombin plasma proteins which combines with the thrombin and inactivates it. Okay. So, like a heparin one of the drug of choice for the it will be okay. This is already some of the anticoagulants. Okay. If they like for example any heart patients, any like a heart patients will be there, no, if they will clot the blood, what will happen? So, they may have the severe problem. So, that is the reason. So, it will see the, it will act as a anticoagulants. Okay, next one is the coumarins of a plant origin are the precursors of anticoagulants such as warfarin, okay, and which is anticoagulants to vitamin K and thus prevent the synthesis of the blood clotting factors 12, 2, 7, 9, 10 and formed in the liver. These are all the factors are formed in the liver. So, these are some of the examples of the anticoagulants. It will prevent the clotting of the blood in the body of the human. Okay. And clotting of blood in test tubes in the clinical laboratories and blood banks can be prevented by the addition of the citrates or oxalates of the sodium, ethylene, diamine and tetracetate acid. They bond to calcium ions and thus make calcium unavailable for the action in clotting. Okay, sometimes if there any laboratory or any diagnostic findings, some of the tests may be required for the clotting of the blood. So sometimes they may use for to prevent clotting. Okay, to prevent the clotting, so they will use some of the antigens. These are like examples here, sodium, ethylene, diamine. These are all some of the agents they may use for the to prevent the clotting. So to prevent the some of the only they need some soluble blood only, they need liquid blood only, they need for this confirmation some of the diagnosis. For that is the reason only some of they will use some of the agents to prevent the blood clotting. It's clear. These are all some things will be there. Okay, next one. Okay, next here the one more important, this is also very important questions. Only I am discussing the only important questions. Structure in this one important only, respiratory system is also important, and next clotting of the blood also very important, and next one is arteries and veins. Differentiations between the arteries and veins. Okay, now arteries always carry the arteries always carry the oxygenated blood from the heart except the pulmonary artery. You got it my point? So arteries are auricles, veins are venules. These are all the things will be same only. Okay, arteries always carry the, you should remind one thing, it's will bright red in color. So oxygenated, consisting of the oxygen. Okay, purified blood. Oxygenated is nothing but the purified blood. It will be purified. Okay, after that only it will supply to the blood vessels to all over the body parts in the human body. So got it my point? Okay. So arteries always it will carry the oxygenated blood from the heart except the pulmonary. This is the only, arteries always carry the oxygenated, it's consisting of the oxygen, it is also known as the oxygenated and purified blood. Next coming to the veins. So here the veins always carry the deoxygenated blood towards the heart. Okay, it will collect the blood deoxygenated but impurified, it's not purified. Okay, so it will it will receive the impurified or deoxygenated blood from the different parts of the body to the heart for purification. Is got it? Okay, veins always carry the deoxygenated blood from different parts of the body to the heart except the pulmonary veins. Okay, here the only pulmonary artery, here the only pulmonary veins. You got it? Arteries oxygenated. Okay, arteries oxygenated, veins deoxygenated. You got it? Okay, arteries oxygenated, artery oxygenated, artery oxygenated. You just keep in mind, then only you will able to differentiate the arteries and veins. Okay, why means if you have the medical department people, you should know about the arteries and veins. That is best of you. Okay, next one is these are the bright in red color. Always if the blood is oxygenated, the color will be like this, bright red in color, veins dark red in color. Next, they are mostly deep, or mostly where it will be located deep seated in the body. Here veins are generally superficial will be there. Okay, arteries are the thick walled, as a tunica media is relatively thick, which smooth muscles and two elastic luminae. Okay, arteries are always the thick walled. Okay, whereas veins are thin walled, tunica media. Okay, is related with thin with one elastic lamina, and walls are slightly muscular. Okay, next lumen is narrow, lumen is wide. This is the narrow, this is the wide, this is the narrow, this is the wide. Okay, opposite. Okay, next non-valvular, next valvular. Okay, next blood in the arteries flows with more pressure and by jerks. Okay, it will supply the blood in the arteries. So okay, the arteries will be flow with the more pressure and by jerks. Why means here the blood will be carry the oxygenated blood, it will supply more flow, it will arteries flow with more pressure to the different parts of the body. Arteries end in capillaries, arteries always it will end in capillaries. Okay, next coming to the here the veins are the blood in the veins flows steadily with relatively low pressure. Veins start with the capillaries, so that is the reason we will give the any like a intravenous injections, we have to give the slowly. Got it my point? Okay, blood in the veins flows steadily. Steadily is nothing but the very slowly with relatively low pressure. Okay, so when you are giving the IM injections, we will give fastly, not fastly, like adequate enough, within the enough time only we will give the injections to the patients. But whereas if you are giving the intravenous injections Actually the blood in the veins flow steadily. So that is the we always, when you are giving the, if you are preferable any IV injections, intravenous injections, we have to give slowly. You got it? So these are some of the differentiations between the arteries and veins. Arteries always carry the oxygenated blood to the different parts of the body except the pulmonary artery. Okay, veins always carry the deoxygenated blood from different parts of the body to the heart for purification of the blood. Okay, it's clear. Okay, so next, the smallest vessels present in the walls of the large blood vessels like aortic arches are called vasa. Okay, vasorum, the vessels of the vessels. It is also known as the vessels of the vessels. Okay, smallest vessels present in the walls of the large blood vessels. It is also called as like aortic arches. The aortic arch is also called as a vasorum, vessels of the vessels. You got it? So next, coming to the next one. This is an important question. Next, capillaries. You have to know the capillaries. So capillaries is nothing but like these are the smallest blood vessels of the body which connect arterioles and venules. Unlike the vessels of the arteries and venous systems, the walls of the capillaries are composed of just one cell thick layer, simple squamous epithelium or endothelium. The absence of smooth muscles and connective tissue layers permits rapid exchange of materials between the blood and the tissues. Capillaries. Okay, capillaries is like a hair like structure will be there, hair like size will be there, like that much will be there. Okay, so these are the some of the capillaries. So still now you know about the, it will smallest blood vessels of the body, it will hair like structures will be there. Okay, smallest blood vessels of the body which will connect the arterioles and venules to supply the blood. It may be oxygenated or it may be deoxygenated. You got it? Okay, next. So till now I discussed like a mechanisms of the clotting factor, differentiation between the arteries and veins and the capillaries. So next I will give the some of the brief explanation, brief notes on the disorders of the circulatory system. If the any problem will be there in the circulatory system of the heart, some of the problems will be there, like a hypotension, HTN, shortcut HTN is hypertension. Hyper is nothing, the hypertension, the BP, actual normal BP, normal blood pressure of the human being is 120 by 80 millimeters of mercury will be there. Okay, if the BB is low, BB is high, like a 140 to 90. Okay, if the BP is 140 by 90 mm of Hg, it is known as a hypertension. 60, it is also known as a hypotension. Okay, here hyper means it's extending, very high. When hypo means less. Okay. Hypertension is a chronic medical condition in which blood pressure in the arteries are elevated. Automatically, arteries always carry the oxygenated blood. No, so automatically what will happen here? The arteries is elevated. Automatically, it will raise the normal blood pressure is at rest in 120. Rest is nothing but it's a normal BP of the patients, normal BP of the persons. Okay. Okay, blood pressure leads to heart diseases. If the any problem will be there, like if you see the is a force exerted by the blood against the walls of the blood vessels, it is affected by any age, any sex or state of the health. If the condition of if the physical condition is not good, automatically they will may think, it may going on overthinking, stress, some of the stress related problems, it automatically it will elevating the BP of the patients. Okay, blood pressure is measured in the brachial artery of the arm by using a sphygmomanometer. So I told no, like if you will watch my videos, okay, I have given some of the like sites of the pulse. So once again I want to give the brief here. So sites of the pulse. This is the temporal. So here the here the temporal will be the artery. If you feel it here, you will heard some of the sound that is known as a pulse. Okay, like if you keep in mind, 3 fingers you have to keep like this. You have to place it over this temporal bone. Okay, this is a temporal artery. Next carotid artery, here just keep it like this. 3 fingers you have to place over here. Now you can feel it. Just you do it once, then you will feel it. Okay, here this is a temporal artery, this is a temporal carotid, and next coming to the apical pulse. Apical pulse is nothing but the left breast just over or near the left breast, below the left breast, just feel it. Okay, below the left breast. Next coming to the brachial. So brachial is nothing but here okay, here will be there, no. So just you imagine here. Okay, so how the BP will check, that is known as a brachial artery. Okay, and next coming the femoral. Okay, groins or femoral inguinal, so things will be there. That's okay. Next here the brachial. After that brachial, this is a radial. Okay, here I kept here in a watch, whereas we have to keep it the 3 hands. Okay, next this is a temporal, carotid, apical, brachial, radial, next inguinal, next back of the knee joint, back of the knee joint you have to place it, and last one is the ankle joints. Okay, so these are the some of the pulse sites of the pulse. Okay, so here the brachial artery of the arm by using a sphygmomanometer. How we can measure the BP with the help of the sphygmomanometer, but everybody used to speak out like a BP operators only. Okay, and this is a 120 by 80 millimeters of mercury. Okay, mm of Hg. Okay, this is considered normal BP in human beings. The upper reading pertains to systolic pressure and the lower one called as the diastolic pressure. Blood pressure above 140 by 90 is considered as a hypertension. It's worth knowing that it is universally believed that excessive intake of salt causes hypertension in addition to genetic disorders. Sometimes they may have the history of the problem, okay, family history, genetic history, same thing. If the any problem, the parents will be have BP, automatically they may have the heart problems. If they have the cancer, like remaining people, so 50% chances will be there, even though we cannot like exactly. You may get it, you may not get it. Okay, exactly. We didn't get anything, but it may have the history of. The scientific proofs will be the like a history will be this. That is the reason we so we have to, if the parents may have the history of any like a diabetes or a heart disease or anything, we have to be very careful by taking the precautions. Definitely we can prevent it. Okay. Okay, next we have coronary heart disease. Okay, coronary heart disease, it is also known as atherosclerotic heart disease. It's mainly accumulation of the calcium and fat. Okay, if they will have the accumulation of the fat, cholesterol and fibrous tissue along with the walls of the coronary arteries. So what will have the formation of the fat within the blood vessels, the blood if the fat deposition will be there over the blood vessels, automatically what will happen? The blood may not be flow in a proper way. That is the reason they may have the coronary heart disease. Okay, it's a lack of myocardial cells may die due to lack of oxygen, and this is called as a myocardial infections. Okay, automatically here the blood vessels may be stuck by the fat or cholesterol. So this leads to narrowing of the blood vessels. If the having the narrow of the blood vessels, it will reduces the blood flow to the heart. So it will cause as a ischemia. Okay, is restriction of blood supply to muscle tissue. So what will happen if the blood supply will be not sufficient to the blood tissue, so it causing the shortage of oxygen to the tissues. That is the reason the myocardial cells automatically will, it may die. So due to lack of oxygen, it may not supplying from the blood vessels to the brain, okay, to the different parts of the body, it may be heart. So that is the reason what will happen. Okay, automatically it will stuck due to the problem, the oxygen may be less, the tissue may be damaged or die. So that is the reason the patients may get the coronary heart disease. It is maybe accumulation of the fat or cholesterol in the blood vessels. It leads to narrowing of the blood vessels. It leads to insufficient supply of the blood to the muscle tissue, causing damage, or it may be die due to the lack of oxygen. So that is the reason the patient may have the myocardial myocardial infections. Okay, it leads to heart muscle damage. Okay. Next one is some risk factors will be if the patient may have the smoking, diabetes or hypertension, the patients may have this problem. Okay, next angina pectoris. Angina pectoris is also known as a chest pain. Okay, narrowing of the blood vessels to the heart, it is known as ischemia. Angina means warning signals of the deprivation of the blood vessels to the heart muscles. So these are also some of the disorders of the heart. Next, heart failure. So heart failure is also called here the CHF, coronary congestive heart failure. Okay, congestive heart failure is mainly if the heart is unable to provide sufficient pumping action to distribute blood flow to meet the needs of the body. So how it will happen means if the heart is unable to provide the sufficient pumping action to distribute the blood flow to meet the needs of the body. So commonly it will occur the heart failure, include the myocardial infections. Myocardial infection also is one of the reason. Okay, if the patient may have the accumulation of the clot in the blood vessels, what will happen? The blood is unable to pump to the different parts of the body. So what will happen? Automatically the patient may have the heart failure. Okay, localized death of the heart tissue, necrosis. Necrosis is nothing but the death. Okay, ischemic heart disease, hypertension, it's also congestive heart failure. Okay, so it's mainly the congestion of the lungs is one of the main symptoms of the disease. Okay, so these are all finally then the patient may have the cardiac arrest. So these are all the problems will be the accumulation of the fat, calcium, cholesterol in the blood vessels. So due to that only the blood vessels may be narrow, unable to supply the sufficient blood to the meet the needs of the body systems. Is clear? Okay, so this is the reason only so many problems will be there, like a heart failure, also angina pectoris. Angina pectoris is nothing but the chest pain. Okay, in unable to insufficient supply of the blood to the parts of the body. That's the reason we may have the problem. Coronary heart disease, hypertension. These are all the problems will be there. Okay, you go through the some of the important 2 marks questions here. The okay, auricular appendix. This is not that much important. Go, okay, bundle of fits. Okay, just you go to this cardiac arrest. Okay, cardiopulmonary arrest. Okay, the cardiac arrest is important. And next here the mitral wall. This is the walls of the myocardial infarction. Also they may ask 2 marks questions. Tricuspid walls. Okay, remaining myocardial infarction. These are all this only. Just you have to keep it in mind. English medium student, there is no problem for reading. I think that's the reason I provide this content for you. If you want interest, you can go through this. Okay, I don't have proper content. That is the reason I provide this content for you people. Okay. Next coming to the next cardiac cycle. So here the cardiac cycle. Okay, so before that, so next coming video I am going to discuss about the cardiac cycle. So until then, take care, bye bye, have a nice day. Okay, Jai Hind, Jai Bharat. If you are watching first time, please watch till the end of my video. Sorry, already this is last ending. No, if you like this video, please share, comment and subscribe my channel, and you have to hit the bell icon also for more needed updated information. Okay, I will try to provide the needed theory and practical content for you people. I hope this video is maybe helpful for you. Okay, thanks to all once again for patiently you are watching my channel. Okay, thanks you.